Well, thank everybody for having us come speak tonight at the Pink House. We are the Integrative Oncology team at Atrium Health, but I always say that we are cancer center agnostic. We don't care who your cancer doctor is or where you go. We're here to help you with whatever you're dealing with on the cancer journey. So I am Dr. Chasse Bailey-Dorton. I am the Chief of Integrative Oncology at Atrium Health at Levine. I'm also happy to be a 19-year breast cancer survivor. So I see a lot of familiar faces. Hey, Gloria, on the screen today, and some names that I'm happy to see you guys here. We are all about helping you deal with the cancer diagnosis, cancer treatment, cancer recovery, and what you can do to help yourself get stronger for having been through it. So I'm pleased to have my partners here who really make our program stronger. And we're going to hopefully cover a lot of topics. And then let's take questions along the way. And like I said, then I'll wrap up. So first up is going to be Dr. Rebecca Greiner. She is our physician assistant in the program. She leads a lot of our research programs. She has a special interest in culinary medicine. And she's really fantastic at what she does with the patients. So I'm going to let Rebecca speak first, and then I'll introduce Dr. H. Rebecca.
Thank you, Dr. Bailey-Dorton. It is really a pleasure to be here tonight. I really thank you for giving me this opportunity. So I do have some slides, so I'm going to see if I can share my screen. So let's see how this works. Okay, can you see some slides?
Yeah, we see them.
Okay, so last time I tried to do this on Zoom, let me see if I can do the slideshow. It didn't work last time I tried to do the slideshow. Let's see. But I will try. Let's see. From the beginning. Still okay?
Yes.
Okay, great. So as Dr. Bailey-Dorton said, I'm going to cover quite a bit of information tonight, and basically it is going to involve how to keep your diet and your environment healthy. So there's a lot of just broad kind of information that I'm going to go over. If you have specific questions, please put them in the chat, and Dr. Bailey-Dorton, please feel free to interrupt me at any time. Sometimes I'm not really good at following the chat. Actually, I can't even see it from my screen right now. So please just stop me. I don't mind if you interrupt if it's a good time. So we will get started. So we have time to get through everything. So the first topic I'm going to talk about is nutrition. Your eating pattern. I don't really like the name diet because that kind of implies that it's sort of a short-term process, which it's not. Basically, we're kind of in this for the long run and just trying to change eating patterns over time in a slow, consistent manner that, we can maintain. So these are just 6 kind of broad areas that I'm going to cover and go into more detail as I go through the slides. But just to get us started, tips to improve our nutrition or eating pattern. The first one is to eat mainly unprocessed whole foods. And I'll go into sort of what that means. Eat a variety of colors. That's pretty self-explanatory, but I'll give you some tips on how to do that. Shop the perimeter of the grocery store. Another tip that we'll kind of go into. Read labels. That's a huge area. I'm happy to delve into that with anybody individually at a later time, but I'll give you some kind of overall things that you can do as far as reading labels if that's new for you. Keeping a food log. That's actually one of my number one things that I'll talk about. And basically, this is just to become aware of what you are eating. A lot of times we can eat mindlessly. We come home from work or from shopping or from whatever and just start nibbling, and we just don't even pay attention really. And before you know it, we've kind of gone through a bag of chips or something like that. I know none of you would do that. But it's really good just to keep a food log of what you eat, the type of foods, and how much. So we'll talk a little bit more about that. And also a good one to get more fruits is eating fruit for dessert. Okay, so let's move on. So again, my first real tip before you start making any kind of changes is to find out exactly what you're doing. And this is, I recommend this to a lot of people. And actually I do it every couple of months or so. I may not actually write it down anymore, but I will mentally kind of keep a track in my mind of what I'm eating, because I do fall off the wagon quite a bit, specifically especially the last 2 months. So basically what you want to do with this food log is to put down the food that you're eating, the method of preparation, and the one big important thing is portion size, especially if you're interested in weight management. Portion size is huge. There's portions are actually really small, and the time of day. So that time you can kind of maybe hone in on a time that you're really snacking, or hone in on the time that maybe you didn't get enough to eat or drink and you got dehydrated. So that's kind of the idea behind that. So you can do this on paper. There's also phone applications that are great for this. MyFitnessPal and Noom are two really good applications. I think they both have some sort of free component, and then you can pay a little bit more per month if you want some more. I've had a lot of patients and friends use Noom specifically for weight management. So that might be something you would want to look into. Also, if you do a lot of cooking at home, the recipe analysis is interesting. MyFitnessPal and Noom, they also have recipe analysis, but these are some that are free down on the bottom. And you can, actually, I think it's pretty easy. You can just take a picture of the recipe and somehow the program can read it and give you the analysis of what's in one serving. And again, I'll say here that portion size is important to know what a serving size is. And so what I'll do is some of this, you can have these slides. I don't know how you guys usually do this, or I can put them in like a Word document and hand them out too. So Leslie, you can let me know what you would like for me to do so people have this information. So the next tip is to increase your whole food, unprocessed food intake. So basically this means to reduce your processed food intake. And I'll show you on the next slide a little bit about what processed means and why we want whole foods instead of processed foods. Another way to increase your whole food intake is to increase vegetables and fruits. And these are the whole fruits and the whole vegetables. And the reason those are so important is because they do contain lots of vitamins and minerals that we know about and lots that we don't. They also have a lot of fiber and a lot of different types of nutrients that are good for us. Increase healthy fats. These are things like nuts, avocados, the mono unsaturated and poly unsaturated fats. The thing here is if you are interested in weight management at all, just be aware of the portion size. It's pretty small. And so I can also give you some information on portion size if that's something that people would like as well. Another way, a good easy way to increase whole food intake is to batch cook beans and whole grains. So you make a big pot of beans or a big pot of whole grains. It's really a hands-off type of activity, and then you can just separate them into different containers and freeze them, and then you can pull them out. And that can help you increase your whole food intake instead of eating, processed grains or beans. So a little bit more about the processed. So unprocessed is food as it would be found in nature. These are highest in nutrients and fiber. So a whole carrot, a whole cucumber, that type of thing. Then there's what they call processed. And this is, things that are minimally processed, like canned beans. Those are still pretty good, but there is a little bit of processed in there. So not all processed foods are bad. Even frozen foods sometimes, sorry, I'm not sure what this is. I don't know if you guys can see that. Frozen foods, sometimes if foods are out of season, that's a good option. And we'll talk about that a little bit later. But then ultra processed are foods which contain few nutrients and fiber. and they're usually sourced from corn, soy, or wheat. And they also have added fat and sugar, and really they contain things that we can't pronounce and that we don't really know what they are. And so there will be times when you'll have to eat ultra processed food for one reason or another. I often think of in the airport. It's, they do have better choices now, but sometimes it's just all they have or all you can get to. But for the most part, we're going with the unprocessed.
Rebecca, do you have any tips? There's a question about how to handle sometimes this sudden increase of fiber to our diet, especially the lovely after effect some folks get with beans.
Yes, that's a great question. I would really I tell people to start out with 1 or 2 tablespoons of beans. Anytime you're increasing your fiber, just start slowly. If you want to add beans, I would do a tablespoon or 2. If you want to add ground flaxseed, that's another source of fiber. Don't start with 2 tablespoons, start with a teaspoon or 2 on something. So just start slow and then gradually increase.
Thank you. And that's the other question that someone mentioned too, is about flaxseed. We know that ground flaxseed are good for the diet. We recommend the ground flaxseed rather than the flaxseed oil because there's a little bit different makeup. And the question came up about soy foods. And we do recommend, even for ER positive breast cancer, whole soy products are good for us in moderation. This could be tofu, edamame, miso, tempeh, unsweetened soy milk. I think the processed or ultra processed soy foods are just as bad as some of the other things.
Yep. Thank you. Okay, so eat a variety of colors. Just some ideas of the ways you can incorporate this into your life is choose a different veggie each week. Every time you go to the grocery store, try something new, try something that's a different color. As far as fruit goes, try frozen fruit. This is slightly processed, but often they pick it in the field and it's frozen. And sometimes off season, it has more nutrients than what you might find over in the produce section. So frozen berries, organic, great choice. I'm hoping to do a little series on what to do with a bag of frozen berries because it's got such good nutrition in it. And it's a great thing to, sprinkle on yogurt. Just eat by itself as a dessert. It's really a good thing to do if you can't get the fresh. And also, variety of colors can also come in spices and herbs. And these are a great way to get a bunch of different nutrients that you might not otherwise get. All those different flavors and the spices and the herbs, those are a sign of all kinds of different nutrients that we don't normally get. So it's a great thing to try that. And I often tell people, that I don't want to buy a whole thing of cilantro because I never use it all. Well, just go ahead and use the whole thing. It's not going to be overpowering. I'll buy cilantro for some salad dressing. It calls for maybe half a cup. Well, I just put the whole thing in there because I don't want to waste it. And it's fine. And you're getting more nutrients. Okay. Okay, so shop the perimeter of the grocery store. So if you think about when you go in most grocery stores, the perimeter is where the unprocessed food is. So you usually have like a produce department. There's, you go back and there's usually meats there on the perimeter. There's there's also dairy. And sometimes even the frozen stuff has the less processed food. So think about that when you're shopping. We'll of course need some things from the inside, some of your whole grains and things like that. But for the most part, you can think about shopping on the perimeter. If you do eat meat, think about trying to eat smaller portions of grass-fed organic meat or chicken or turkey. We recommend that if you can. It's more expensive, but you don't need much, maybe the size of your palm or a little bit less. If you choose to eat dairy, low-fat, grass-fed, organic is the best choice for that.
Add in that, Rebecca makes a great point about the grocery store. If you look at the way grocery stores are laid out, you have, what do you have in the front? You have the bakery, you have the good aromas, you have the, sometimes the florist is up front. And what do you commonly want when you go to grocery store? Often is milk, where you have to walk all the way through the whole store to get there. So it's not set up for us to eat healthy food. It's set up for them to sell things. So it's kind of fascinating to look at that. So some great points, Rebecca.
Yes, thank you. So read labels. So just some quick tips on what to think about when you're looking at a label. So and we are all going to have to eat some processed food. So if you're thinking about processed food and you want to look at it, try to keep the ingredient list under 8. Eat foods with ingredients you can pronounce. And think about whole foods. We think about, the carrots that we buy and the apples, and most of the time those don't even have labels. So that's another indication. If food doesn't have a label, it's less processed, a whole food. And then the big one on the bottom is sugar, and I'll go into a little bit about this as well. So the American Heart Association suggests that we limit our sugar intake for women less than 26 grams a day. And so let's talk, this is added sugar. So let me talk a little bit more about that, showing you something. Okay, so there's different kinds of sugar. There is natural sugar, which you will find in fruits and vegetables. It's also in milk and dairy. It's lactose is the sugar in those. So those are natural sugars. And with those natural sugars, there are fiber and nutrients. So we don't want to just eat these things, of course. We want a varied diet, but we typically don't recommend eliminating this type of added sugar from your diet. So added sugar is over here, and this is all the things that we think about. It's also in a lot of processed foods, donuts, cookies, cereal, Pop-Tarts, those types of things. And it really has no fiber or nutrients. So those are two different things. And now the labels, thankfully, they are required to have added sugars. So it will look something like total carbohydrates, and then it will have added sugars. And that's what you want to pay attention to. So if you have a yogurt that's got some type of sweetener in it, it's going to have natural sugar and added. And added is the one that you're most concerned about. Okay. And then regarding sugar, when you're looking at labels and ingredient lists, these are a lot of different names for sugar. So some people, want to really eat the honey and the molasses and those types of things because they're more natural. And they're less processed, but for the most part, they still count as sugar. So this is a big area if you're trying to think about weight management. Maybe start reading the labels for added sugar and trying to reduce that a little bit. And then eat fruit for dessert. Increase intake of berries. This is one area where those frozen berries can come in handy. You can add fruit, cinnamon, small amount of nuts and seeds to yogurt for dessert. But of course, enjoy your desserts on special occasions. There are going to be things that you're going to want to enjoy. And we certainly, are not saying never eat these kinds of foods, but save them and then really enjoy them when you have them. And then this last one doesn't really fit with anything, so I just put it here because it has to do with eating. Is consider a 13-hour fasting. I don't really think fasting is the right word here because I think of fasting as like 24, a long time, but this is really just 13 hours without food. And the earlier you can start it in the evening, the better, like 6 or 7, and then don't eat 7 or 8 the next morning. And that really gives the body a rest from food. It eliminates a lot of the hormone activation that goes on after eating late at night that might keep us up. It could contribute to hot flashes, weight gain, that kind of thing. So it's something to try or think about trying. Okay. So now I'm going to jump into the environment, and I really don't have a lot of time. So this is a huge area. We could spend
you got plenty of time, Rebecca. Take your time.
Okay. So this is a huge area, and so I will kind of, since Dr. Bailey-Dorton said I have a little bit more time, I'll kind of go over it with you. And again, I'm happy to answer any questions that you have specifically. So the first tip is to, let me see if I can go forward. Read your labels and know what your ingredients are. So this is really hard with with cleaners and things like that. But the more that you can glance at the label, kind of read the warnings, the more you're going to learn about different products. And basically, one of the big things about this area is to use natural cleaning products as much as you can. And these would be things like lemon juice, vinegar, baking soda, more of a scrubbing, physical kind of removal of dirt instead of chemical. Those types of things is what you want to kind of use as much as you can. As far as personal care products, use products that are free of carcinogens. There's chemicals that are endocrine disruptors and fragrance. And I will give you a little bit of information in a few minutes about how to find products that are free of these chemicals. When you're thinking about clothing, this was a real eye-opener to me. Using natural fabrics, that makes sense. But, sorry, let me take a sip. There was also information when I was going through this research about limiting use of items with stain repellents and flame retardants and dry cleaning that uses perchloroethylene. The other thing that was interesting, I really thought the stain repellents. I really didn't think about that. I think the no iron clothing is probably not the best either. Probably got some kind of chemical on it. And I know for one, I have several shirts that are no iron. They're great. And I'm not saying to replace all your clothing by any means. And I want to make that point now with any of this stuff, with the environmental tips and tricks. I don't want you to throw everything out and replace everything, but as things get old and as you need to replace items, think about what you might want to purchase instead of maybe the same item that you had, something that might be a little healthier. Other things about ingredients are limit candle use. They've been shown to put things out into the air when you burn them. Air fresheners and again, anything with fragrance. They really harp on fragrance. I mean, if you can smell it, that means there's some kind of chemical in the air, and it's thought to maybe cause allergies and headaches and some things in some people. I'm sorry about that. Okay. Oh my goodness, I don't know, why is my phone doing this?
I think, Connie, did you have a question? You have your hand up.
Question. Okay, just stop me if they do.
Someone had a question about essential oils.
Okay, well, we actually go ahead. You want to answer that?
I can take. So I think there is some research on essential oil benefit. Certainly for like lavender for sleep and some other things. So we don't mind some of these things aromatically. It's when people ingest them that we have a little bit more concern about, or even topically, sometimes it might be okay. But just remember the same thing, just as essential oils might have healing power, Rebecca's demonstrated that these other things might have an adverse effect. So we want to kind of balance some of that out, but that is a good question.
Yeah. So in addition to reading labels and kind of knowing your ingredients, you want to think about keeping your air clean. An easy way to do this is take your shoes off at the store, at the door. Set something up there where you can get them organized, or a box even is fine. That way you're not tracking everything in from outside. No stuff off the sidewalk, no stuff from the yard. Whatever it might be that you don't even know, floor cleaner from somewhere you've walked, that will help a lot. Always use a fume hood when cooking. That will help take some of any kind of chemicals that you might not want to inhale away from you. So always use the fume hood. Avoid the plug-in air filters and spray fresheners. Again, those are chemicals in the air that we don't want. Dust and wet mop often. A lot of the things about cleaning, which I have to admit that I am not good with and I'm trying to get better, is the consistent cleaning. So don't wait and clean, once a month, but if you do it more often, it doesn't get as bad, and then you don't need as harsh chemicals. So that's kind of the idea about that. Minimize the use of plastic. And again, this is an area that I don't expect you, and I don't want you to go throw away everything that you have, but just as things need to be replaced, think about some of these ideas. So try to use glass containers to store things in. You can use glass. A lot of the glass sets come with a plastic top, and that is fine as long as the food's not touching the plastic. So those are fine. I would not microwave the plastic in the microwave. I would put a plate over the glass container or something like that. Limit the use of plastic for storage and in the microwave. So definitely don't microwave any plastic. Use glass, and then again, if you need to put something over top of it, use glass if you can. Limit canned food use, which often contains chemicals. There are some cans now that are BPA free, but they're now, they'll say that, and now there's some other chemical they're using instead of BPA, and the research is not clear on whether this new chemical is safe or not. So I would just limit the canned food use if you can, and definitely don't store them after they're open in the can. Put them in glass. Cookware.
Rebecca, somebody asked about what about the plastic microwave food covers?
I would not use them. I mean, even though, and that's being pretty conservative. I got most of this information from this anti-cancer lifestyle program that we put out, and they're pretty conservative. And since there are pretty easy ways to microwave things without using those plastic covers, I just take the stance of don't use them. Just put a plate over it or something. Does that make sense?
Yes, thank you.
Okay. And as for cooking, another big area, this was really sad to me because I really like the nonstick pan. But it really says to limit your use of these pans. The stuff comes off of it eventually, like physically peels off. And then also when you cook with it at a high temperature, there are fumes given off that we don't want to ingest. Another reason to use the fume hood. So as much as you can, use stainless steel, glass, cast iron, or ceramic for cooking. Again, you don't need to throw anything out, but as those pans start to peel or not look right, I would throw them out and replace them with something else that's a little bit more environmental friendly. Okay. Okay, so the environmental working group. So how do you determine if the products that you have are safe or not? So as far as your personal care products, there is a website within the environmental working group, ewg.org, and this is the website that you can go into, and you can pick up your, trying to see if I have anything here. I have some chapstick here, but you can pick up your product, whatever it is, Burt's Bees Natural, chapstick, type it in to this website, and it will tell you, it will rank the product overall on how healthy it is, and if it is approved by the environmental working group, and also go through each individual ingredient in the product and tell you, oh, this is an endocrine disruptor, or this is, a carcinogen or whatever. It's very, very overwhelming. So what I suggest people do is if you are running out of shampoo and say you want to buy some more shampoo, go on this website. You can look at what you have and see how it ranks. But then you can also put in, there's a button you can click for they will list all the shampoos that they've tested that get a 0 or 1, which is approved by the Environmental Working Group. And then you can just, if you really want to start making changes in that area, you can pick one of those shampoos and buy that one. And you'll know that you've got something that is very, very safe to use in terms of the effect of it on your health. So this takes kind of a lot of time to kind of go through and get started. But once you've looked up a couple of products, you really do get more comfortable with it. And as you start to replace things, you can choose different things that are better for your health. They also have a great review on water filters if you're interested in a water filter. And as I said, they have recommendations for healthier products. So they have done so much research. It's a not-for-profit. It's very reliable information that you can find on there. They have a great section on sunscreen. You know, if you have any questions about that. Let's see my next slide. Where is it? Okay, so just to kind of summarize, I wanted to just remind you to kind of assess your situation first. So for example, do the food log and see what you're eating, see when you're eating it, see how much you're eating. In terms of the environment, start looking at your labels and just kind of figure out what you're using and when and why you're using it. And then I would recommend that you just decide on a small change to make at first, you know, with either nutrition or the environment, and really just do small things at a time so it doesn't get overwhelming. And of course, if things aren't working and your change is not good, that's fine. You know, ditch that change and come up with another change that is working for you. You know, just because you decide on something doesn't mean you have to stick with it. You know, if it's not working for you in your lifestyle, then make another change. The last thing I wanted to talk about was when you're thinking about making a change, think about a SMART goal. And a SMART goal is a specific goal. So what are you specifically going to do? Is it measurable? How much are you going to do or how often? And I want you to make it achievable. You know, this is not something that we're trying to make hard. You know, it's an achievable goal. Is it relevant? Is it going to make you healthier? Is it going to make you feel better? Is it going to, you know, meet some kind of need? And when will you complete this by? So there's all kinds of templates online that you can download and print out. And I think it's great to write it out. I also like the idea of giving yourself a little reward if you complete a SMART goal. You know, that could be a new book, you know, watching a favorite TV show, taking a walk, taking a hike, something like that. I always think it's good to do that. But an example of a SMART goal might be something like, I will try 3 new colorful vegetables each week for the next 2 weeks. And that meets a lot of goals. It increases your unprocessed food intake. It increases the colors that you're eating, and it increases the vegetables. And so even though it seems like a really small goal, it's a really good thing to try, and it doesn't feel so overwhelming. So that's all I have for you today. And again, I want to thank you for inviting me here. And again, I'll take any questions that I need to.
Thank you, Rebecca. That was a great overview. And, you know, part of our mission with Integrative Oncology is that we partner with you. You know, how do we give you some evidence-based strategies that you can do to help yourself? And we know that nutrition's powerful. A lot of us are on anti-estrogen therapies. We know how that can affect our body weight. We know that maintaining a body weight is important. We know that, you know, often patients state, well, I don't know why I got cancer. You know, we're learning a lot now that we're exposed to a lot more chemicals in our environment. And I can't help but wonder that doesn't have a role. As Rebecca said, we're not going to hide in a cave, but we're going to give you step-by-step things to kind of improve that environment. So let's open it up to some questions right now before we go to our next topic. What you got? I think you must have gotten everybody's questions answered, Rebecca. That's a great job. And I think don't let some of the stuff be overwhelming. It's just like Rebecca said, you go step by step. You pick a goal and you go step by step, and know that we're always here to help you along the way if you have any questions. But great job, Rebecca. Thank you. So we're going to, oh, wait a minute. I might have a question here. Let's see here. No, overwhelming. Great. We agree. So I'm glad everybody took some notes. And like I said, this all will be available afterwards. So now we want to switch over to have Dr. Hariharan speak with us today, or as we affectionately call her, Dr. H. She is a primary care doc by background, also fellowship trained. She's currently seeing patients at Moorhead University, Huntersville. We're getting her spread all over the place. But Dr. Hariharan, if you want to speak now about your topic.
Great, thanks. And thank you guys for inviting me also. And thanks everyone for taking the time to join on their Monday evening. So I'm going to speak a little bit about stress management and about mind-body practices. I also have a few slides just so we have something to look at. Let me just figure out how to share them. Oh, shit. Okay. Can you guys see my slides now?
Yes.
Okay, great. Okay, perfect. And also feel free to use a little hand raising, or as we've been doing, using the chat to ask any questions. I'm kind of going to give a big just overview of a pretty huge topic, so not going into a lot of detail about specific practices. So anything that anyone's interested in hearing more about, then please just chime in at any point. So I wanted to talk about stress management, and I like talking about stress management and mind-body practices because when we're thinking about whole health and integrative health, we're thinking about a balance of the mind, body, and spirit. And stress is something that affects all of those pieces, and something that just being humans and living, we all experience in some form through our lives. So first, I wanted to just talk about the stress response and kind of what happens in our body when we experience stress. So we have developed, or humans have, this stress response that is a whole physiological cascade of events that occur when we're put in front of a stressful situation. And this is something I'm sure all of you have heard about before, but we call it the fight or flight response, which is what one piece of our nervous system does. The sympathetic nervous system is in charge of that. So it really was designed over time so that people could, if they were in an acute situation of danger, they were able to run or get away or respond in an appropriate way to get away from danger. And so what happens in these situations is we have a whole kind of domino effect of different hormones and stress hormones like cortisol and adrenaline that then create certain responses in the body, like having our heart race. We start breathing faster, our blood pressure goes up. And then also some functions that are not needed in those acute situations will be quieted down or temporarily kind of not necessarily stopped, but not energy isn't put into them, like digestion, which is a really important one. So that's not a priority when we're in a situation of acute stress. So that's kind of tampered down at that time. But what can happen over time when we have chronic daily stress, which doesn't need to be huge stressors, but can just be day-to-day things like, emails and work and traffic and things like that, is this chronic daily stress. If we don't start to manage it, we can eventually start to have that whole big cascade of events occurring with just these little things. So I may get annoyed when I'm stuck in traffic, and all of a sudden these hormones will start to, the hormonal cascade will occur, and maybe I start breathing faster and get tense. And so with these day-to-day stressors, what we can get in a situation of is having this big stress response for smaller things. And so when we have these chronic daily stressors that can affect various points or various pieces of our health, including including parts of our mind, body, and spirit, and overall wellness. And so chronic daily stress can definitely be a contributor to inflammation, which, then can contribute to disease and cancer risk and things like that. Chronic daily stress can also affect our immune system and lower our immune function. It can also definitely have effect on our metabolism, our ability to maintain a healthy weight. Certainly can affect our sleep health, which then has other important effects. Chronic daily stress can be a big contributor to fatigue as well. So that can be a reason why we feel low energy or low mood. Certainly can affect our digestive health. The connection between the mind and the gut is very strong. You'll often hear people refer to the gut as kind of our second brain, because we have so many nerve endings and important hormones that are produced in the gut, and that we can literally feel emotions in our gut, which I'm sure we're all familiar with. And then certainly chronic stress can affect our cardiovascular health as well. So the good news is that there's a lot of tools and a variety of things that we can use to start to break this cycle. And so that's what I want to focus more on, is the things that we can use to put the control back in our hands. I wanted to focus on mind-body practices in particular today. So mind-body practices are, again, kind of a big term for a variety of tools and things that we can use to strengthen that connection between our mind and our body, and ways that we can harness in that stress response and create less of that intense response for just daily things, and even for larger stressors, ways that we can kind of build the resiliency of our mind and body and be more adaptable to stress. So I'll just kind of overview a few different things of what mind-body practices include. So this can include things like guided meditations, which I'll give you some resources on those. Breath work, which is a favorite of mine because it's something very simple that any of us can learn and can access at any time. Mindfulness practices, which can include like a mindfulness sitting meditation. Mindfulness can also include things like mindful walking, mindful eating, so being mindful in our day-to-day. Music therapy can also be considered a mind-body practice. Mantra meditation, which is a form of meditation of repeating meaningful words or phrases and getting into a meditative state in that way. Guided imagery, which I'll also give you some resources on, is a type of guided meditation where we're going through a visual process in our mind, or kind of a journey in our mind. Movement meditations, another favorite of mine, can include things like yoga, Tai Chi, or Qigong. Another cool one is called progressive muscle relaxation, which I'll mention again briefly later. So any types of movement meditations, which I think movement meditations are great and really well fitted for a lot of folks, especially if you tend to be a little more on the anxious side or very busy minded, which I think many of us tend to be just by the nature of how much stimulus we're constantly receiving and the world we live in. So movement meditations can be a great introduction to mind-body practices as well. Being in nature, or what's called forest bathing, being in a nature setting can also be a form of meditation and mind-body practice. And then absolutely prayer or spiritual practices can fit into this realm as well. I wanted to talk a little bit more about breathwork, because as I mentioned, that's kind of one of my favorite things in this mind-body realm, and I think one of the most powerful tools that we have at our disposal. So our breath is kind of the master controller of what goes on with our nervous system, with this whole fight or flight versus the opposite, rest and digest parts of our nervous system. So controlling our breath and doing different specific types of breathing techniques can be a way for us to kind of directly tap into our nervous system and to gain control over what's going on in there. And the breath is really kind of our road or our connector between our mind and our body. And again, breathwork can be extremely simple. Anybody can learn it, and it's always at our disposal. So we can use it as a medicine at any point that we need. So one specific one I wanted to make mention of that is a really easy tool is ratio breathing. And ratio breathing just means counting how many seconds or counts we inhale versus exhale. And a specific thing I wanted to mention is any practice where we are extending our exhale to be longer than our inhale. So for example, if we were to breathe in for a count of 4 and breathe out for a count of 6 or a count of 8, that practice of extending out our exhale is a way for us to tap into that autonomic nervous system and to trigger the opposite of the fight or flight, but that rest and digest. So a way for us to tap into the more calming side of our nervous system. And so that can be a really simple tool to use and even spend 30 seconds or a minute on if we're noticing we're sitting in traffic or some trigger occurs and we're starting to feel stress rising in our body. With regards to meditation, if it's something that you are not as familiar with or have never tried, I think the term meditation can feel intimidating sometimes because we may have a certain image in our mind of somebody sitting quietly for 30 minutes and having no thoughts, and that can feel impossible. And really, that's not the case in most scenarios. Meditation is a big term, again, for several of the things I mentioned earlier in the mind-body realm. And so meditation can include things like guided meditation or, again, movement meditations, walking outside in nature, yoga, practices like that. If it's something have never done before, then I think guided meditations can be a really good intro into practices of meditation as well, because guided meditations will basically take you through the steps of a practice of what to focus on in your thoughts, what to focus on with your breath. There's a lot of really great resources available for guided meditations. I think meditation apps can be really great tools. The one that I have found the most useful is Insight Timer. Insight Timer does have a free option and a paid option, but the free option has hundreds of meditations on it. And they have really good quality teachers on there, which is why I really like that one. But the apps can be really great because you'll see on there as well that you don't have to spend 30 minutes a day on a practice like this. It can just be a 5-minute practice or such. And again, there's a lot of different types too. So if you didn't like a certain style, try a different one. Or if you didn't like a certain teacher on there, try a different one. But they can also be a good way to, if you decide to get into a practice, which I'll encourage you to do, a good way to keep yourself accountable, because most of these apps will kind of tell you, how long you did a practice and how frequently and that kind of thing. There's also a lot of great meditation resources on music streaming services like Spotify or Apple Music and things like that. If you just type in guided meditation, you can find different things. You can also be more specific. For example, if you wanted a guided meditation for sleep, you can just type that in and you'll find dozens of resources. YouTube is also another good resource. There's another really nice online resource for guided imagery, which is called Healing Journeys. I'll put it in the chat in a second, but there's a link to a library of these specific guided imagery meditations that's free online, and it has there's specific meditations for specific purposes. For example, for pain management or preparing for a surgery or getting to sleep. So different things like that. So again, you can really use stuff like this like medicine. And then there's a lot of meditation classes available, both online and in the community. A lot of yoga studios and places like that may have meditation classes. And we also have some through LCI, which I'll make mention of as well. Actually, I'll talk about that now. So I put this up here too. I think Dr. Bailey-Dorton is going to speak a little bit more on this, but I also wanted to mention other healing modalities which can be very useful for stress management, such as acupuncture, which certainly can have many other benefits as well, but also other body therapies like various types of massage therapy, and healing touch, which acupuncture, massage, and healing touch are modalities that we have available through supportive oncology at LCI as well, if you guys are plugged into that. Healing touch is an energy medicine practice, which energy medicine is kind of a whole other realm of therapies that can be really beneficial for stress management. But these can be great tools, even if energy medicine is something totally new to you. And then I also mentioned some of the movement practices that we have through LCI as well, including therapeutic yoga, Tai Chi, and Qigong, which can also be forms of meditation as well. I just wanted to make a quick mention of sleep health. This is a whole topic on its own, but certainly the quality of our sleep is quite important for how our bodies handle stress, for our mood, and such. And so I won't go into detail on this, but just wanted to make mention of that, and we can discuss further if anyone's interested. But maintaining a healthy sleep routine and getting as good quality sleep as possible is certainly important. I know that's not always easy, so there's lots of tools we can use for that as well, but I won't go too into depth on that. So in terms of mind-body practices and stress management and such, I think a great place to start, and this can be available to anyone, is just to start with maybe dedicating 5 minutes a day, and maybe don't call it a meditation practice or anything specific, but 5 minutes a day for self-care. And that can look very different for everybody, because just taking this small amount of time out for something that's related to your self-care can have a lot of benefits down the road. So more specifically with regards to mind-body practices, there's a lot of studies and good research showing that just 5 minutes a day of a practice like mindfulness or meditation or breath work can actually produce physiologic changes in our body. So in these studies, people have seen reduction in things like markers of inflammation, or in people's blood pressure, or in cognitive function, concentration, things like that. So just that 5 minutes a day, for example, using a meditation app, can start to produce changes in our minds and our bodies. And the other thing I would think about is these practices kind of like exercise for our minds. So if you were to work out and lift weights, if you do that every day for 30 days, you're going to start to feel stronger, and you're going to start to notice that you can do certain, different things a little easier. And so kind of the same thing, same concept applies to meditation and mind-body practices. The more that we practice them, the more that the benefits that we may experience during that practice, whether it's feeling more relaxed or feeling more focused when we're done, or feeling like our mood is a little more even, those effects will start to grow longer and will start to kind of diffuse out into our day. So the cool thing is that the more that we practice these types of things and are able to tap into that nervous system and kind of harness in what's going on in our minds and our bodies, the more that response in our bodies can kind of kick in automatically when we experience these chronic, little daily stressors. So, then that time when you are stuck in traffic wouldn't have maybe that would have been really frustrating or irritating, then we may eventually not have that whole flood of response that occurs with stress hormones going up and our breathing going up and heart rate going up. So the benefits will become more evident and will also last longer the more that we practice these. I put the point of sacred touch. So sacred touch is a term for kind of the healing we can do on ourselves. And this is kind of in the realm of energy medicine. But for example, placing our hands over our heart center, or placing our hands in prayer, or placing them over our eyes when we're feeling tired or overwhelmed. We can use this as a form of self-care as well, a way to kind of tune into ourselves, check in with ourselves. A practice that I like to do often is putting my hands over my heart center and then just focusing on my breath. Sometimes it's just for 10 seconds. But that short check-in with ourselves and acknowledgement of self-care can really be pretty powerful as well. And I wanted to make a point too that, having these little practices and things that can conceptually be simple but can have great impact definitely can be empowering. So use them as tools to empower yourself, but also if you practice them and you still feel lousy or stressed, give yourself grace. So sometimes we can feel like, oh, we have all these tools at our disposal. Why do I still feel stressed out? We don't want that to start creating a sense of guilt or defeat in ourselves. And so I think just be mindful of that and also give yourself some grace and honor and acknowledge even the short bits of time that you can spend on self-care and practices like this. Something I always like to make mention of is allow yourself to take breaks from the news, from social media, from just all of this constant stimulus that we're all receiving all the time, because that certainly can have a negative impact on our mind, body, spirit wellness for sure. So sometime, you may want to say you're not going to read the news for 24 hours. And I assure you that if something earth-shattering happens, you'll find out about it anyway. So try to just take breaks from this, because we're just in the nature of the society we live in, we're kind of constantly bombarded with information. So allow yourself some time and some space to breathe from that type of thing. And to that point, set boundaries for yourself, not just for things like that, but also for social obligations or things you do for others. It's okay to say no sometimes, and that is a part of self-care as well. And the last point I wanted to mention was allowing yourself to feel a full spectrum of emotions. So a term that you may have heard is toxic positivity, which I think is an important point to make. That sometimes, I think especially when you're, have gone through or going through any kind of cancer treatment, it can feel a little overwhelming to feel the need to always be positive or to think of all the things you're grateful for and things like that. And sometimes that can actually be harmful to us. So it's important that if you are feeling sad or angry or frustrated, it's okay to lean into those emotions and process those emotions, because we don't want to just push them away and always think of the positive. That's not necessarily healthy too. So life is full of ebbs and flows, and it's important for us to feel through all of those. And then with regards to stress and mental wellness, also always remember that medications can have a place, therapy and such can have a really important place as well. And so those are resources that we or your oncologist or primary care doctor can always plug you into as well. So just keep that in mind. And then I wanted to mention also, actually on the point of Sacred Touch and the Heart Center, I am working on a guided meditation, a heart-centered meditation with our music therapist at LCI. So we're going to have a nice recording that's a guided meditation practice related to the Heart Center. So that's something I'll be happy to share too in the coming days when that's all done as well. So maybe we can send it to you guys or have a link to it or something like that. But it's a nice 10-minute maximum guided meditation practice that I would be glad to share. So that's kind of the overview of everything I wanted to touch on, but I would love to hear if anybody has questions or interest in any of those specific things or anything I mentioned. I know it was a really quick overview, but yes, I would love to talk more about any certain things if you're interested or anything related to stress management, mind-body practices, anything at all.
Thank you, Dr. H. That was a great overview on a very important topic. And, as often we say to patients, other than a cancer diagnosis and a pandemic, any other stressors going on for you. And so we're chronically all in this situation, and, we're never going to get away with stress. It's always going to be there. But these are some ways that you can deal with turning that stress response off. And the other thing I'll add is We certainly see the fight or flight, but I'm seeing more of a freeze, which is a third thing, where you just feel so overwhelmed that you just shut down and don't feel like you can do anything. And all this is powerful for that. I know for myself, getting started, meditation was something really hard for me to get started with, and yoga was an easy way for me to get started. It included some movement, and it certainly helped turn off that fight or fight response. And Dr. H might mention that a little bit later. So
yeah, absolutely. Sorry.
Can you see the questions?
I lost the screen. I'm trying to find it again. What did I do? Oh, there we go. Okay. Yeah, really cool. So Kiva mentioned that she completed her own yoga teacher training during recovery and found it really helpful. I think that's great. There's a lot of really wonderful yoga teacher trainings in the community now. And I've found a lot of people don't do it necessarily because they want to be a yoga teacher. You can just learn so much about self-care and practices through the right training. And that's really cool that you did that. Somebody mentioned guided meditations for sleep have been really helpful. That's a really great point. So what I find when I talk with folks about difficulty with sleep, one of the biggest barriers is my mind's racing at night. I can't quiet my mind. And so I think guided meditations for sleep can be really great tools because one, you have something that you're physically listening to, and so that can be a way to kind of get out of your mind, and it's walking you through a practice, so you're focusing on one specific thing, so it's a little easier to harness things in and not get lost in your own thoughts. And ideally over time you're asleep before the meditation is over. So I think those can be great, and again, you can find great guided meditations for sleep on Spotify and Apple Music and YouTube and things like that. There's another practice called Yoga Nidra, which is a form of yoga. Yoga Nidra is sort of similar to guided meditation. It's called yogic sleep, and in theory, you can do it at any time of the day. And they say doing a 1 hour yoga nidra practice is like getting 7 hours of sleep or something like that. So it's kind of a restorative practice. But I often recommend it to people to do before bed because you do it lying down in your bed, ready to sleep. And it's, again, just kind of a guided practice you go through in your mind. So you're not physically moving or, doing yoga poses or anything, but you're just going through practice in your mind. And Laura mentioned it's okay to feel sad and disappointed and not always feeling perfect and victorious and, defeating cancer and things. So I think that's a really important point because I think that can just be exhausting sometimes of, trying to be positive all the time. And it's okay to feel, sad or scared or frustrated. Kathy mentioned guided imagery was very helpful during radiation sessions. That's wonderful. And Laura also mentioned healing touch was helpful for post-op pain. That's great. So healing touch can be great for not only stress, but also pain, anxiety, different things like that. I'm going to put that link for Health Journeys. It's a really long link, so I think you'd have to copy paste it, but this is a free resource for some guided imagery practices that are pretty nice.
And the healing journeys, they have some specifically for during chemo. They have some specifically for going through radiation, just specifically for cancer. So it's a great resource. So those are great questions. So I want to kind of come in and really open this up to more of a dialogue with all the folks that are on here and kind of wrap it up for us. Often when you hear about integrative medicine, the first thing people bring up is supplements. And as you can tell, that's something we don't necessarily focus on. We think there's a lot of other things that you can do to help yourself during treatment or with side effects or recovery, even decreasing risk of recurrence. So we want to look at all these other buckets when we deal with patients. As we've said, nutrition is so important. Exercise is so important. Sleep is so important. I've never met a cancer survivor yet that didn't have trouble sleeping at some point in time. Environment is important. stress management, spiritual and social and personal relationships are important. And then as we deal more and more with some of the side effects of treatment, how do we deal with some of the weight gain that some of us get, which is a risk factor? How do we deal with some of the hot flashes, some of the joint pain? That's where a lot of these integrative strategies can come in to help. But as we've said, we also want to give you the tools to know that you're doing something yourself. You're not just having treatment done to you. And so I think that's where the topics tonight were perfect for that. So really want to open it up to hear some questions, because you have at your disposal right now the three integrative folks from LCI. So let me hear your questions. Let's make this where we can help you with any questions or issues that you have.
Ladies, don't be shy. This is a wonderful opportunity.
Come on, guys.
I have a
Come on, Merritt. Come on, Merritt.
Hey, good to see all of y'all. I have a question about preventative testing of estrogen metabolites. So I know that you can be tested for, what your not your cancer markers, but your estrogen and how estrogen breaks down in the body to see sort of what estrogen metabolites you have. And I'm curious as to whether or not that's something that you think is beneficial. I mean, I have a long history of breast and estrogen positive cancers in my family. So I'm curious for myself, is that something that you ever see people doing? Do you know what I'm?
Well, yeah, usually my response when folks ask about measuring estrogen levels is that's just one point in time. Our levels fluctuate constantly. So just testing it at one point in time doesn't really, I think, give us the big picture that we need. So I think if we're concerned about the extra estrogen levels or what our levels are, that we need to look at the bigger picture, meaning, body weight. We used to think that fat cells didn't do anything, but we know that they're producing inflammation in the body and they're raising the estrogen level. We know that, some of the exposure to some chemicals are xenoestrogens, as Rebecca talked about, that can act like estrogen in our body. We know that stress has an effect on some of these hormonal fluctuations in our body. We know that sleep has a role. So even if somebody came in and they had these higher levels, I'd want to look at all those aspects. At the same time, we know that some of our chemo preventive agents do block estrogen, like your tamoxifens or your relaxofens or some of those medications. So we know it plays a role. I just don't think we have, in my opinion, the research to make that direct connection. And I'll open that up to Dr. H if you have a different response to that.
Yeah, and can I just jump in there? And what I mean is not testing estrogen levels, but the types of estrogen that it breaks down to, and like the good estrogens, bad estrogen types that it metabolizes into.
And I would kind of give the same response. I'm not sure if the in my mind, the research has caught it with the clinical applications of that at this point in time.
Okay.
I would agree with that. I think that's kind of a newer thought, more in like a functional medicine testing realm. So I wouldn't say that we have a lot of solid ground to stand on in terms of knowing this equals that or this leads to that. So I would also say big picture. I feel the same way.
So that might be something that's coming. I just don't think probably we're there yet.
Okay, thanks. I was curious about that. Thank you.
So there's the question here about neuropathy and chemo. We love if we can get patients right when they're diagnosed and just starting chemo to get them in acupuncture. We've seen a lot of great results using acupuncture for this neuropathy that happens. That's usually our first go-to. There is some use. Someone asked about alpha lipoic acid. There was a lot of research with that, especially in diabetics who tend to have some neuropathy. And sometimes we will add that on if the acupuncture is not doing it. So that's a great question. The other question is, what would you say are the top 3 things you recommend survivors can do to prevent recurrence? So often for me, I use the example of a basement that got mold in it. So when I got cancer, it's like getting mold in the basement, right? So typically what we do is we have surgery that removes the mold. We might put chemo or chemicals on the basement to remove the mold. We might radiate the mold. But if we don't change that basement, that mold's more likely to come back. And the same thing for that cancer. If we don't change where we were when we got diagnosed, I think we're more likely to have a recurrence. And that's all the things we're talking about here. You know, nutrition, exercise, body weight, sleep, stress, environment, everything. What can we do to put ourselves, or what can we do to become stronger and healthier for having been through that? And that's where all these things we're talking about is giving you some control back to put you in a different place. And I think helps reduce that recurrence and giving you some control back. This question here about says, after I became a Medicare customer, I was told via a phone conversation to the Integrative Meds office that Medicare is out of pocket. Is that true? So our initial consult with either Dr. H or myself or follow-up visits for Rebecca are billed just like regular insurance. Some of the integrative strategies that we've talked about, we've been very blessed to have a strong philanthropy base. So they are either covered by philanthropy, so there's no charge to you, or they're provided at a much lower cost. For instance, our acupuncture, which is available at the Moorhead office or Pineville, is done in a group setting, so the cost is much lower than if you went out in the community and got it. We also have some grant funding if even that lower cost is out of reach for some folks. Our healing touch has no charge to our patients. Our classes have no charge to our patients, and our massage therapy has a lower cost too. So no, we do see Medicare patients for that office visit.
Are any of these services available at Northeast?
Dr. H?
So we have, right now, we have massage therapists and healing touch practitioners at Northeast, and we are hopeful that in the next handful of months that we'll have acupuncture either at Northeast or possibly Huntersville, at least somewhere closer to up there. And then in terms of the integrative consult, I am at Huntersville now as well, and also in the future, near future, may at least be up at Northeast a couple days a month or something. And then all the classes right now are virtual still too, so anyone can access them from anywhere.
And that's one of the blessings that's come out of the COVID pandemic is we're able to do a lot of virtual visits. So we can do a visit with somebody in their home as a consult. Any other questions? Well, I said I thank the Pink House for giving us the opportunity. I know, integrative medicine is such a large
question about estrogen inhibitors. What preventative strategies for using this drug? Do you see that last question?
Mm-hmm. Are you referring to the side effects from the estrogen blockers? I'm going to assume they are. So typically the ones we see, such as bone density. Well, for bone density, tamoxifen actually helps the bone density. It's the aromatase inhibitors that affect the bone density. For that, we talk about certainly checking a vitamin D level. It's one of the most important things we do. Maintaining a normal weight, nutrition, and weight-bearing exercise for that bone health are the key factors for that. And then sort of the common side effects we see, we mentioned hot flashes. We certainly also see a lot of these joint pains and joint stiffness that comes with them. There's some research that shows if we get your vitamin D level to a certain range, that lessens. And then we know if we get you moving more, sometimes we use some different supplements for that, or the acupuncture. There's a whole bunch of stuff that we can do. And I always say a lot of this stuff, what we're trying to do is load the boat with as much stuff that's going to benefit you without sinking the boat, because there's just so much misinformation on the internet. There are just so many people trying to sell us things. Suddenly all your family and friends are experts telling you what you should do or shouldn't do. And we want to be that resource to really help you balance that boat out so that it benefits you. Like I said, thank you for having us tonight. We are always available. Like I said, we're happy to see patients. We don't care who your doctor is. We're here for you to help you get through this. I'd like to ask Dr. H maybe to close us out with a little meditation. We've talked about it, so let's walk the walk tonight.
Cool. Okay. Thanks. So let's just do a really simple breathwork practice. Since I mentioned the ratio breathing, we'll just walk through a really brief, easy practice, a way to slowly lengthen our exhales, and again, a way to kind of tune into that restful, rest and digest relaxation response. So if you want to just sit comfortably, as with any, meditation practice, you can sit however is comfortable for you, chair, floor, back supported, however you feel good. If you feel comfortable, you can close your eyes, or otherwise just soften your gaze, maybe focus your sight on one point. And so let's first just notice our breathing. We'll breathe, if comfortable and if okay, in and out of the nose. So first just observe the flow of air in and out of your nose. You can have your hands resting in your lap, or if you want to place them anywhere, like over your heart or over your eyes, you can. And we'll slowly just start to deepen the breath. And by deepen the breath, I mean feel and pull air further down into your lungs. Feel your chest expanding. Maybe eventually feeling your rib cage expanding. And eventually feeling your belly expanding at the bottom of your inhale. So let's start by breathing in for a count of 4 and out for a count of 4. You can go at what pace is comfortable for you, but something like breathing in, 2, 3, 4, and out, 2, 3, 4. So we'll just keep that rhythm for a moment. Breathing in for your count of 4 and breathing out for your count of 4. And on your next set of breath, let's breathe in for a count of 4 and breathe out for a count of 5. Breathing in through the nose for a count of 4 and breathing out for a count of 5. And repeat that for a few cycles. And on your next round of breath, try breathing in for a count of 4 and breathing out for a count of 6. And if that's comfortable, you can even extend it out to 7 or 8. It's breathing in for 4 and breathing out for a full count of 6, maybe longer. And on your next round, continue breathing in for 4 and out for 6. And if it's comfortable, just pause at the bottom of your exhale for about 2 counts before breathing in again. Breathing in for 4, out for 6, and pausing before breathing in again. And take a few rounds of breath here. And on your next round of breath, you can just go back to whatever is a comfortable, relaxed breathing pattern for you. Maybe take one more deep breath in through the nose and exhale through the mouth. And when you feel ready, you can open your eyes if they were closed. Thanks for joining me in that little practice. So again, even just spending 30 seconds or a minute on a little breathing practice like that can actually create changes in our mind and body. It can be really powerful little tools. Use them like medicine.
Thank you. Back to you, Leslie.
This was absolutely amazing. It was the overview, the different topics that you talked about, the number of participants from the Pink House that joined us. I'm just absolutely thrilled. And thank you so much for spending your time, all three of you, after a busy day, sharing your expertise with us. We are so grateful.